Everyone. Good evening, good evening, good evening. It is our last virtual educational Juneteenth series, at least for this series. Welcome back for you guys who have stuck and stayed with us. This is the fifth night. We've been doing this since last Tuesday. We've covered wonderful topics. We talked about freedom's promise and Juneteenth's legacy, liberation, and the path forward. We did economic apartheid, the redlining, reality in Black America, followed up with echoes of emancipation, charting the course for reparative justice. And last night we had the power of Black currency. This evening, our last evening, we're going to talk about the growing patient advocacy, tackling health disparities and substance use in the Black community. And we have some great panelists. I'm looking forward to this wonderful conversation. And I am your host, Saida Dunstan, the CEO of ElmCorp. And we've been bringing this to you guys. This is our fourth year. And for those who this is your first time, we were really excited to do these virtual education series around Juneteenth. The holiday became a public holiday, but for us, it is really about our desire to continue to move towards liberation as a people. And how do we educate? We didn't want to just be in the park on Juneteenth, which we will. Tomorrow we'll be at Roy Wilkins at 12 p.m. Don't worry, we will have a lot of hydration stations. We can't talk about health the day before. With the hospital administrator, she was like, make sure. We were like, yes, we've got it. But we will be outside. But we didn't want to just go to the park without putting in context all what we're fighting for and what Juneteenth really means. And so we're excited to have this last evening on our fourth time, our fourth year doing this with these great folks. We bring this to you, sponsored by ElmCorp, also by our esteemed Assemblywoman Alicia Hyman, and Voice. The voice of youth changes everything are the three teams that come together every year to pull this off. And so I don't see the Assemblywoman. We also may have another guest that pops in. And so when they come in, we'll let them into the conversation. But for right now, I want to introduce our panelists. They have very lengthy, we say this every night because it's the truth, very lengthy bios. Because they've been doing a lot of work and we want to make sure that they're recognized, but we're not going to read the whole thing. But please, by all means, follow up with these folks, check them out. You can find them on LinkedIn, I'm sure, and get all the information. So we're going to begin with Lorraine Chambers Lewis. She serves right now as the executive director overseeing the day-to-day operations and strategic plans for Long Island Jewish Hospital in Forest Hills, a 312-bed community hospital located in the heart of Queens, the most diverse county in the nation. The healthcare team provides inpatient medical, surgical, and intensive care, as well as women's health services. And she is a Queens native herself. She's been a physician assistant since 1993. She's worked in emergency medicine, critical care, internal medicine, occupational health. She began her career at Queens Hospital Center and then came to the North Shore LIJ Health System in 2002 as a supervising PA in Long Island Jewish Medical Center's emergency department. She's launched the Northwell's first injury management prevention program for worker safety. And under her leadership during COVID, she was able to launch COVID-19 testing programs for team members and their families, an employee vaccination program that immunized over 70,000 team members. She's dedicated to her community and she serves on several boards of Queens organizations. Welcome, Lorraine, this evening. Second up, we have Cassandra Frederique. She is the executive director of the Drug Policy Alliance, a national nonprofit that works to end the war on drugs, which has disproportionately harmed Black, Latinx, Indigenous, immigrant, and LGBTQ communities and builds alternatives grounded in science, compassion, health, and human rights during her time at DPA. Frederique has built and led innovative campaigns around policing, the overdose crisis, and marijuana legislation, each with the consistent racial justice focus. Her advocacy and all of the Drug Policy Alliance work lies in the intersection of health, equity, autonomy, and justice. She's been featured in the New York Times, MSNBC, US Today, National Public Radio, and the Netflix documentary Grass is Greener. She has received numerous awards and has also been recognized both by Essence Magazine's Woke 100 and the Roots Root 100. Thank you so much for coming with us tonight, Ms. Frederique. And last, definitely not least, we have Cheryl Marius. Is it Marius? I want to make sure I get it, your last name right. I didn't ask you before. I apologize for that, Cheryl. Cheryl Marius, she's a native New Yorker from Harlem. Cheryl Marius is a committed public servant with extensive experience in community development and public administration, particularly in the fields of substance use and mental health disorders. She possesses a deep understanding of social determinants of health and their impact on the quality of life. Cheryl's career began in 1994 as a director of HIV/AIDS services in a nonprofit organization serving incarcerated women on Rikers Island, and then spent 13 years of her career at Addicts Rehabilitation Center, many of us just call it ARC, as a clinical supervisor and a director. She has had continued impactful work as a director of both Northwell Health and Mount Sinai Health Systems, focusing on medication-assisted treatment for substance use disorders. She remains deeply engaged with her Harlem community and serves on several boards and organizations. Cheryl and her family are now in their third generation to continue to reside in Harlem. Welcome, Cheryl. This is a wonderful panel. I'm getting ready to have this conversation. We do also want to make sure that the community is aware, whether you're following us on Facebook Live right now or you're here in this Zoom link, please make sure to put the questions. Oh, bring them on. Oh, okay. Senator Comrie, if you could turn your video on so they could pin you. I understand the senator is here. So we'll wait a little bit, but for those in the community, if you want to pose a question, you can put it in the chat here if you're on the Zoom, and if you are in Facebook land, by all means, still pose your questions. We do have a team that will come on around 7:15, 7:20 and be able to pose your questions that you have for the panel. Is the senator ready, guys? My tech team in the back. All right.
I'm mobile right now. I'll get on there. I'll turn on my video in a few.
All right, Senator. Well, being that we know he's here because he's spoken, let me at least provide a little bit of his bio for you guys before we start the questions. So New York Senator Leroy Comrie, a friend to Queens and Elmcor, is on and will be with us tonight. He's been elected to represent the 14th Senatorial District of Queens that encompasses south side of Queens. We're on the north side, so you know, it's the south side of Queens, portions of Jamaica, Cambria Heights, Queens Village, Hollis, St. Albans, Laurelton, Jamaica Estates, Briarwood, Hillcrest, and Kew Gardens. Woo, a lot of areas since 2014. He grew up in South Queens, in the communities that he represents now, and it's always good to have a representative from the community. Senator Comrie believes that government must be responsive to the needs of all people. His office is the conduit through which access to quality education, healthcare, and services for older adults, programs, and resources are for youth. Senator Comrie served 12 years in New York City Council, during which he held the title of Deputy Majority Leader and the Chairman of the Queens Delegation, while holding many distinguished and critical leadership roles. Senator Comrie's positive impact in government is evident with his long track record of legislative accomplishments, such as increasing tax exemptions for older adults, instituting the city's first foreclosure prevention program, and curtailing payday loans. Throughout COVID-19 pandemic, Senator Comrie continued the use of assets of his office to ensure his constituents had easy access to food, COVID-19 testing, cardiovascular care, the vaccine, and other critical resources. It's important that I say this part as we close his bio. Leroy Comrie Jr. is the son of the late Ruby Frith Comrie and the late Leroy Comrie Jr., both whom immigrated to the United States from Jamaica. The reason why it was important, it is Caribbean Heritage Month. And so every time I see it on someone's bio that they're bigging up their Caribbean roots, as a shameful Trini I just make sure that we say it this month. And so welcome, Senator. So we're gonna start. I'm gonna kind of intro our topic tonight, and then we will get to the questions. I will pose it and I will give it to the first person. And by all means, after that, everyone kind of just chime in and we'll just keep talking. We're in community, talking to community for the betterment of our community. So this evening, we will discuss the complex tapestry of patient advocacy within the spheres of substance use, mental health, and its connection to healthcare as a whole, and their profound impacts on the Black community. Our conversation aims to not just illuminate the disparities, but to motivate the community to enact change. At the heart of our discussion lies the acknowledgement of a systemic pipeline that perpetuates these health inequities. From historical injustices to present day systemic abuses, we explore the roots that have sown the seeds of disparity in healthcare access and the outcomes. Mistrust of medical and mental institutions is rooted deeply inside the Black community as a result of generations of racism, discrimination, and trauma. Our panel will dissect the multi-layered challenge of advocating for patients in a system fraught with bias and microaggressions, while also spotlighting the resilience and advocacy of the burgeoning within Black communities. We're going to give just a little bit of data because we think in order to ground this conversation, we just want to kind of put in perspective when we say substance use and mental health issues and healthcare overall, what does that mean? So for Black women, according to 2021 statistics, overdoses are now the fourth leading cause of death, only behind cancer, COVID-19, and heart disease. For Black men, there are 54.1 fatal drug overdoses for every 100,000 people, compared to 44.2 fatal drug overdoses for every 100,000 people of white men. For Black teenagers, overdose deaths increased fivefold from 2019 to 2021. Black children are about 14% less likely than white youth to receive treatment for depression. In 2019, suicide was the second leading cause of death for Black and African Americans ages 15 to 24. Self-reported suicide attempts rose nearly 80% among Black adolescents from 1991 to 2019. While the prevalence of attempts did not change significantly among those of other races and ethnicities. Black adults are 20% more likely to experience serious mental health problems such as major depressive disorder and generalized anxiety disorder. More than 80% of Black Americans are very concerned about stigma associated with mental illness, which discourages them from seeking treatment. So I know that that is a lot of data that could sound and is very grim, but it's as we said at the beginning, it is really not just data of an unhealthy group of people, but it is data of a group of people that has been systemically placed in a particular situation, of which racism does definitely play a huge part on how we either engage with healthcare, we'll talk later about stress, but how it impacts the health of a community. And so it's important as we talk about Juneteenth and the liberation of people, is that healthcare and our health is critical as a part of what we talk about, our ability to continue to fight for our liberation. So the first question that I'm going to pose to Cheryl, I'm gonna let you go first. We read your bio before the senator, but you'll be the first to jump in. What are the factors impacting the rise of Black overdose rates, and what can be done within communities to address the overdose epidemic?
Very good question. So we all know that the social determinants of health play a major part with what's going on today. On top of, during COVID, mental health ran rapid. I was working at a drug program, so of course, we were considered essential workers. And as I walked those streets on 125th Street, mental health was prevalent. Individuals were not taking their medication. Individuals were on the streets needing help every day. That also played a factor with overdose. In the Black community, there's no real statistics. Even though we have overdose, it's connected to suicide sometimes, but that rate has not been teased out of all the overdose that are happening. So the social determinants of health play a deep part in what we're dealing with today, with mental health, with overdose, with drug addiction, with so many things. We live in an economy where people are trying to figure out how to eat every day. I can walk outside and see a long line for the pantry, not in just one location, in several locations. So unless things change, homelessness has increased incredible. It's a lot of trauma that we are dealing with every day in our lives. And unless we address it through therapy, it's going to get even harder for us.
Cassandra, you want to tackle that question? What are some of the factors impacting the rise of Black overdose rates, and what can be done within communities to address the overdose epidemic?
Yeah, I mean, I agree with what Cheryl was saying. I would add it's therapy, but it's also the structural things that are happening in our communities. There is a level of divestment that is happening in Black health nationwide. We have less access to primary medical care. We have less access to clean and healthy foods. We have less access to affordable housing. And in our neighborhoods where we have been, we are being pushed out, right? And so the infrastructure of Black life is consistently under attack and being deteriorated and denigrated systematically by the policies that people are passing and the lack of investment that is happening in our community. So large communities, what we're seeing with Black overdose, I don't think it is a coincidence for us to see the rise of these certain conditions, not just overdose, but obesity, diabetes, like all these different chronic conditions are systematically connected to the structural factors that are being taken away, right? And so I think there's a lot of conversation, health information about what we can do individually, right? Like eating better, going to therapy, doing all those things, but no amount of therapy is going to help you if they keep raising your rent, right? No amount of like eat better today posters in the supermarkets or in the buildings is going to help people if they don't have access to a primary care physician. And so I think when we look at the overdose rates, I think there are a lot of individual interventions that we can apply, but that should not distract us from the conditions that are being shaped for which these things are outcomes of. And I really appreciate your point, Saida, around it's not that our community uses the most drugs or is the most unhealthy or is the one that's, it's not that. It's that structurally our community's outcomes are shaped by and driven by the structural factors around us, which are the social determinants of health that Cheryl talked about. And then also, you know, one of the things that we argue is that the drug war is a social determinant, right? So how close the drug war is to someone's life in their neighborhood also shapes their the likelihood of what their health outcomes.
Lorraine, do you want to take a stab at this question?
Yeah, I won't belabor it, but my colleagues here, my esteemed colleagues, are just really hitting the nail on the head, right? So there's local access to care, right, for the behavioral health needs, because there's definitely a shortage of behavioral health needs nationwide. And you can imagine in some of our communities, what is it there? And so it makes it even harder. And it's difficult to navigate to get into the right level of care. So you have things from A to Z in terms of what your needs are. Some people need to be actually admitted into the hospital. So you need inpatient beds for that. That's a whole nother issue. And then you need people who have chronic care issues where they need support and medications and things like that. And so all of that exists on top of a structure that's fragile, as Cassandra's describing, right? And so, when you talk about social determinants of health, just to paint the picture, and I'm sure this audience is a very, very well informed audience, but 80% of what's going to determine your life expectancy or your quality of life is determined by your zip code. How's that? I'm a very strong advocate for local access to care. You make things hard for people to get to it. They're essential workers, they don't necessarily have sick time. They have to keep pushing on. They have to keep trucking. And so they don't have the time to go say, I'm going to go drive over there or take a bus over there or take a day off. I don't have PTO. And so with all those things on top of an already existing circumstance, COVID just pushed it over the top. And people died in certain communities. But one thing that I think is helpful with COVID, it made it blatantly clear to anybody who wouldn't listen that this is a major issue for certain populations. And so what I hope to do is to continue that conversation. Don't let it die out, because people have short memories.
Yeah. Senator, do you want to take a stab at this question before we move to the next one? I know his camera's off. That's the thing about legislators, they're always working. So he might be on a call taking care of something right now. I do want to also say, as an anti-racist, one of the things that we also, Lorraine, you said something, very, very powerful, but like you said, many of us know, but many of us don't know about the fact that our zip code really does dictate so many factors in our lives. And I think as we talked about redlining, like I said, we layer this, right? We talked about redlining, and yesterday we talked about Black currency. As an anti-racist, we want to make sure that we say we don't use Black and brown or Black and poor interchangeably, because you can be in a zip code with Black folks, a middle class, or even some time of high influence and high finance, and still be in the same situation. Because we say clearly, as we talk about this being connected to Juneteenth, race in this country and being Black trumps all determinants. And so, how racism is really embedded in everything that we do, that even when we talked about redlining, how it plays to zip codes and how that plays to health and our determinants. These are huge things that I think are important. So, Senator, did you hear the question? Did you want to take a stab at that question? It was about what are some of the factors that are impacting the rise of Black overdose rates, and what can be done within communities to address the overdose epidemic?
Well, there is an increase in overdose. Unfortunately, there's an increase in many harmful things that are happening in the Black community. The primary issue is that we need to rally in a more focused manner to address them in a holistic manner, because between the rise of marijuana, there's a legal substance, between the use of social media as a as a negative, which creates a negative and unholistic approach to our kids, the rise in disconnected youth. They're using substances more than ever to find some type of relief. We need to, as a society, do more to push to get these numbers out, to come to Albany and to lobby about these issues, to work with us in the Black, Latino, Asian caucus to deal with it, and to make sure that we are fighting to get more education and more actually health dollars within our community. Queens, as you know, is underbedded, under-hospitalized. We have the least amount of hospitals and clinics of any borough. We've been trying to fight that. The borough president is trying to build a new hospital in the Rockaways and 2 new clinics in the Rockaways, but it doesn't deal with the disparity. We don't have enough walk-in clinics. We don't have enough nurses in schools. We don't have enough training programs to inform people of what's happening. And we're not reaching back down into our churches like we used to ensure that the churches which used to be a great distribution for our kids, with creating youth programs. So to answer this in a one or two sentence, it's impossible. We need to, and one of the things that I've been focused on is to create after-school programs so that every school is open until 9 p.m. We have to get our kids into safe environments and out off the streets and away from negative influences so that they're not turning to drugs. We have to push the state to create more programming, to create opportunities for children to find positive ways to get things done. We have to push the entities that we know. Another thing that I'm trying to do is to push the MTA and the Port Authority to do more to show young people from elementary school and middle school other career paths so that they are not hanging out in the street from 12 or 1 o'clock when they get out of school, finding negative behaviors, that they could go to programs. We got to keep our libraries open. If we want our society to survive, we as a people have to fight for that. We can't wait for other people to give it to us. So there's a lot that we have to do to try to reduce this dependency on recreational drugs, to try to mitigate whatever personal mental health crisis that someone has moved you into because of their negative desires for you. And we have to try to get to our children and let them know that all of these things are being done to separate them from themselves. So
Thank you.
it's a multifaceted problem with a lot of solutions that we have to come to and work on together.
Yeah, thank you, Senator. I also want, because you spoke a lot about young people, and we did talk about the statistic, but I also want to make sure that the community is well aware, as we talk about overdose, the largest group that are dying and dying alone are Black men over the age of 55. And so as we talk about young people, I just want us to not to forget that those who are dying are our men of middle age, people who've made it, right? People who made it past youth against all odds, really, and have made it to 55 and have died. And so we didn't talk about this component, but a lot of it, and it seems to be very controversial when we talk about it, is when we don't have legal substances, the supply becomes very tainted. And so fentanyl is in many of the supply because when things aren't legal and we don't regulate it, it can be very dangerous. And so men of 55 and above, Black men are dying. So the second question is, racial trauma can increase the risk of Black people meeting the criteria for post-traumatic stress disorder. And stress plays a crucial role in how racism impacts both mental and physical health. Can you discuss some of the health issues that we see disparities with seeing these disparities and disproportionality in due to the increased stress in Black communities? So Cassandra, I'll start with you. I know we started with Cheryl before. If you could just talk about, we talk about stress, but how does that increased stress impact, Black communities?
I think one of the big things that we don't get to talk about often here is the impact of stress on our hearts. And when we think about the stressors and the way that the stress on our heart make everyone less healthy, right? But it makes people who use drugs more susceptible to death. And so when we talk about who is dying right now, the overdose death rate among older Black men, Cheryl talked a little bit about how the data is not often parsed out, is the heart-related deaths that are happening in overdose that have to deal with the stressors, not only from poor nutrition or lack of access to healthy nutrition, the stressors of being in over-criminalized neighborhoods, right? I think there is a professor down in Emory who looked at the role, the health outcomes and the stressors of people who live in neighborhoods that are facing surveillance and criminalization and incarceration, and how those stressors have impacted the health outcomes of people that live in those neighborhoods. And those things matter because if you are ingesting a substance and you're navigating a drug supply that is completely adulterated, you are set up to be, your body can't handle it because your body's already trying to overdo and overwork itself to deal with the stressors that your health is already under. And so oftentimes when we look at the war on drugs as a social determinant of health, part of that reasoning comes from the role that enforcement and prohibition and racism and law enforcement can play in creating the health conditions that people then have to survive in. And so I think one of the clearest factors of that is heart health, and the ways that poor heart health have a direct connection to overdose in the community, and how we're seeing that in the kinds of people that are dying at this particular moment, not just of fentanyl, but also because of the way that cardiac health is not prioritized when people are talking to folks about drugs, because they want to talk to them about not using drugs. And I think a more comprehensive conversation that takes social determinants into consideration would also pair it with cardiac health.
So Lorraine, I'd like to pose that question again to you about racial trauma. In 2020, we had the commissioner of the Office of Mental Health, the State Office of Mental Health, identify racism as a mental health, determinant. It's a part of a health condition, right? And so how does racial trauma that increases PTSD, they said that if you look at most Black folks, if you look at the level of determining factors, that kind of criteria, that's what they said about the criteria of PTSD, we would have more issues than a war veteran, right? That we would have seen more issues in our index than war veterans. And so can you talk a little bit, you're in the hospital, of like the level of what you're seeing when Black people come, with the level of stress and how it's impacting disproportionately their mental health and their physical health?
When you think about post-traumatic stress disorder and how people arrive to that, I'm really glad you're calling it out, because the racial components, when you are a person of color, that's normal for you. It's kind of hard to kind of go outside of that to see what other people experience. The example that I can think of is being a man or a woman. So when I pull up in my driveway, I'm always looking and I'm checking and I'm doing all of this stuff, whatever, right? To kind of make sure that I'm safe before I get out. I have my keys ready, that kind of thing. When I spoke to my husband about that, he's like, I don't do that at all. I just get out the car. And so just to kind of understand that difference, right? Because I think a lot of people can relate to male, female. But, if you have an honest conversation with people who don't have to kind of deal with some of the microaggressions that we're dealing with, we don't know, because that's just normal, and it's hard to parse out. But it's an added stressor on top of things. To kind of really kind of understand, like, you're in stressful environments. Life is very difficult. We all deal with different types of things. You add race onto it. Do you understand the level of pile-on that includes? So that's why I think the data analysis is incredibly important for us to be able to kind of understand this and to call it out. But it's with that kind of science. That's why we need to put resources to that, so we understand it, or else it becomes invisible.
Yeah. Cheryl?
And I agree with what both of my colleagues are saying as far as post-traumatic stress is. I mean, let's take a look at even dealing with someone who is in substance use or mental health. We have post-traumatic stress not even using any drugs as a Black person. We have to go to work and deal with microaggression, worried if we're going to have a job, or if we are doing well enough in the position that we're in, because we have so much to deal with. So it's just not about the person who is battling their addiction, because whoever's battling their addiction, they may have been a circumstance of being raped because they were in the street, a circumstance of trying to figure out how they're going to eat. So I'm sure that post-traumatic stress is at a higher level, but we all, I think all of us as Black and brown people deal with stress, but some use it in a manner of covering up or masking it with drugs or even alcohol, or unfortunately, even possible suicide. That's the reality of what we have to go through today.
And I think, Cheryl, that was really important to, Cassandra, I'm gonna give it back to you to kind of discuss and to say it in alcohol. I think because when we talk a lot about substances and we talk about overdose, we forget about the numbers of people who die from alcohol overdose, right? And that alcohol is still, Cheryl, you've been doing this work longer than me. As a treatment provider, it is still the number one substance that we see in most of our programs, outpatient and inpatient. And so I think it's just really important for people as we talk about, and we will talk about like stigma, like what that does when we're not able to have conversations. And as Lorraine's saying, is to call it out that racial trauma is not just a conversation, it is real and it has real life impacting realities that result in death. And that we need to be able to say that, because as a Black community, as we talk about liberation and where we are now, I think we get to the point that we don't want to say anything because there they go again. But we're going to keep saying it because our people are dying. And so we're going to keep saying it, and we're not going to say it, and we're not going to not say it. Racial trauma is real. And in this country, it has been racialized to have Black people at the bottom. And we have to be direct and clear and be honest. Cassandra, I know you wanted to tag back in on that. Cheryl clearly said something that made you like, I want some. Go ahead.
No, I want to also elevate the fact that we also have to have real conversations about to Cheryl's point, really underlying the motivations for people who use, right? Like, what is the motivation? And those are also shaped by social determinants, right? Like, I think there's a lot of conversation, and I think it's important to have conversations about personal responsibility and accountability when it comes to people's health, right? I think that conversation shows up a lot when we talk about mental health and drug use. I think people have very strong opinions. Like, listen, I'm a Black woman. I'm a Black fat woman, right? So like, people have a lot of conversations about like what my choices are around how I eat, how I take care of myself. But I think one of the things that's also really important, especially as this conversation is talking about patient advocacy, is like, what are the choices people are choosing from? And I think when we talk about health and the stressors, the part of the motivation also is like, why are people choosing these substances? What's behind that? And I feel like a lot of time, a lot of our investment is getting people to stop. But I think, there's the conversation of like, and Saida, we've gone through the People's Institute for Survival and Beyond. It's like, who's throwing the babies in the water, right? Like, everyone's pulling the babies out the river. But what's going up at the top, that these babies keep coming in the water, right? And I think that there hasn't always been a lot of conversation that is sophisticated and distinct and nuanced as to why people are choosing to impact their health in this way. And that those conversations are not only shaped by social determinants, but it also challenges the idea that everyone is making a full choice. People can make choices, but what they choose from is also shaped by people that are not also those people.
Right. And in a racialized society, how we moralize Blackness is embedded in how we look at substance use disorders. And when we talk about addiction for Black folks, it don't quite sound as compassionate as addiction for our white counterparts. And that's the reason why it's important for us to continue to have this conversation. I'm going to come a little bit out of turn of how we had those questions, because I think this is important, because many of you guys are doing the work and you look like the communities that we're talking about. And so we all know the biblical saying, physician, heal thyself. Can we talk about some of the concerns and the strategies that Black healthcare workers, administrators, policymakers, and family caregivers should practice to address their own racially impacted health risks. Lorraine, if you can go first on this one.
Sure, sure. And I know that we're coming up time, so I'll be brief, but I think that, you know, I can speak for Northwell in terms of the wellness programming. And, you have to meet people where they are. There is, particularly with mental health, right? And healthcare workers are not any exception to that as well. And so to what extent can we establish, first of all, the resources, right? And from A to Z, from self-care to peer-to-peer support, to a professional, to admission, to a provider, A to Z, because everybody needs different things at different points. And so providing that, and then how do you communicate that to the healthcare worker in a way where they feel comfortable? Because just having it doesn't help anyone. You have to make them feel comfortable. And I would say for the Black community, obviously the trust issues are there. We've seen that with COVID. As you guys heard, I was in charge of the vaccination efforts for Northwell. And it was extremely challenging to speak to my own community and really try to, really help them understand in order to save their lives, particularly in the beginning. So I think that peer-to-peer conversation is really helpful for them to hear other voices, not just from the organization itself. So I think as much as we can kind of advocate for those type of models in healthcare organizations, I think it's truly important, because at the end of the day, it's going to come down to trust and normalization. And not that we have to rely on celebrities, but when you look at Beyonce or Serena Williams and the issues that they had with maternal health, and how it raised the conversation. Or if you look at Simone Biles, or I forget the sister's name, played tennis, how they took a year off because of mental health. That speaks a lot in our community that we can start having this conversation and it's okay. And so as much as we can kind of echo that and just as a community take responsibility for helping someone along when they're struggling, and it's hard, you have to have courage to do that, but not turn the other way. There's all these resources that are here. How do you kind of get them in or bring another advocate to help you have the conversation?
I think you're making a really good point again, Lorraine, when we say we don't use race and poverty interchangeably. You mentioned some very wealthy people that had a really horrible experience with their own healthcare, and God knows they can afford the best, right? So Cheryl, do you want to talk a little bit, as a person who's been doing direct administration work in substance use and mental health, like, what can we do? Physician heal thyself. What can we do to assure that we are still present for the people who need us?
We can do so much. And I loved what Lorraine said, how she said to meet the person where they're at. Because if you don't, you're going to miss it.
Yes, sir.
They're not going to listen and you're not going to accomplish anything. And then you feel like you were defeated because you didn't help this person. Meet them where they're at. And I used to say that a lot to the clinicians, because the clinicians would come to me and say, well, she doesn't want to do better. I said, but she doesn't want to do it your way. Let her tell you what she needs. You don't have the script. Let her tell you what the trauma she's been through. And then let's add her family. And then let's add a peer. So we have everybody working in this together to make this a accomplished goal for that individual. So I realize all these years that I've been in this field, it's not me by myself. I need the peer who had lived experience. I need the family to understand, because when that person is out on their own, they're going back to their family, and their family no longer, hopefully, is thinking about what they did in the past, but who they are today. And I need continued recovery for that person. So that person may need that mental health therapist or that social worker. We all play a part in changing the lives of individuals. So I think without all that, and specifically meeting a person where they're at, is the most important role we have to play.
So Senator Carmen, I see you put your camera back on. The question right now is about kind of looking at the biblical saying, physician, heal thyself, and talking about strategies. And so Lorraine kind of talked about it as an administrator of a healthcare organization. Charles talked about it as an administrator in behavioral health. As a policymaker, can you talk a little bit about how being more in tune about our own racially impacted health risks, what could policymakers kind of be aware of, or things that can be done to help healthcare workers and others in regards to like their racially impacted health risks? You're muted, Senator.
Sorry, am I still muted? This
No, we can hear
particular
you now.
session, we were focused on just trying to get healthcare workers their wages that they need to have, which we were partially successful in doing, and we still have more to do. As legislators, we need your information expertise to us on a regular basis because we're grinding on budget issues and financial issues and general policy issues. To be honest, we don't get much conversations about the impacts that you're talking about this evening. We're not getting the feedback from the minority doctors and nurses and social workers that are talking about this on the ground. So we need to continue these discussions on a regular basis to make sure that we are informed as a legislative body so that we can also then write legislation to deal with it. So I would be happy to continue to work with this group and get some other minority legislators because we don't have, while we have two minorities that are chair of the health committees, they're winding up doing response work as opposed to creating new visions or working on new issues or dealing with even what's coming down the pike because when you said that, and it reminds me, even when I said earlier about how do we do outreach, how do you, I forget who said it, but reach the people where they are. Well, how do you do that in 2024? They're not going to church as much, they're not on regular social media. How do we do that? So the issues of how we do that effectively and then translate that back up to statistics that we can use to write legislation is a challenge that we need to take on quickly because a lot is happening to our community. So
thank you, Senator. I'm gonna say this to you while we're here all together, as it's the last night of our educational series, and we're so happy that you kind of put it out there. One of the things is what can we do, right? Like, what are the things that community can do? And so, I will take your challenge, and I will organize with Cassandra and Cheryl and Lorraine. We will organize Black healthcare workers, Black behavioral health workers, policy advocates who can come and speak to the Black and Latino and Asian caucus if necessary to kind of talk about these things because we are talking about it.
Right.
And so it's good that we're here together and you're saying you want to hear it and we want to tell you because our people are dying. And we're grateful that Lorraine is at Northwell putting together occupational safety, but occupational safety for Black folks is deep. And so we kind of have to work together. And so thank you for saying you need to hear it because we're going to organize. It is off season, as they say. So we'll look to you to help us organize your colleagues. I know Alicia Hyman, the Assemblywoman who as a part of this, has reached out to Cassandra and I many times on these issues. And so we'll be more than happy. This is an important issue. And I think that's the idea of Juneteenth. We're talking about our own liberation and we will not wait for anybody else to save us. So thank you for asking us.
I need to jump off because I promised to be in two different Zooms and the other one started at 7. I just want to take a minute to thank the panel, for everyone that's on here. And I really look forward to working with all of you. I've had the honor of working with some of you, the youth, Sister Dunstan, and I believe I've worked with Cassandra before. I'm not sure. It's hard to see on Zoom. And I know I've worked with Lorraine and she's doing an excellent job. But I look to work with all of you to check because this is an important issue. And, we can do some things legislatively. We just got to get focused on it. thank you for your efforts and all of your work and the sufferings that you're going through. And in the spirit of Juneteenth, we will take this and make it happen as a group of people. So thank you all for your time.
Thank you
Thank
so much, Sandra. That was wonderful. And please enjoy yourself on the other Zoom. So we're gonna open it up, Ivory, to the community. If you have a question that
Yes.
you want to pose.
We have one question. Based on the number of men in this room alone, how do we begin to reach the men in our lives to talk to them about mental and physical health?
Anybody? I guess I'll say this. It's an all-female cast, of which Senator Comrie was a male representative. And so the question seems, seeing this group of this group of women, how do we engage men, I'll say specifically Black men, to talk about mental health, etc. I will also state yesterday it was a group of men as we talk about wealth. And there was only one woman. So I think there's a lot of conversations as a community we can talk about, but know that representation is important. And so the conversation is, how do we get Black men in the conversation about mental health? Especially when we talk about from a racialized society where we know Black men are put in, as Cassandra said, in a very criminalized space.
I think there needs to be more. I definitely agree with that question you're asking, because I care about my Black men, and I know they're hurting inside and they have a lot more they feel that they have to bring to the table. I definitely, the best way to answer that is for a Black man to understand that mental health, it's okay to talk about, because we can bring you to the water, but we can't have you drink it. So a lot of men, for some reason, have shame behind discussing their feelings and their mental health. And I think that's where the problem lies. So I think for me, whoever posed that